So ladies, have you been feeling not quite up to par sexually? You're just not quite where you really want to be, or you've had a child and when you sneeze you have to cross your legs. And gentlemen, you're just feeling like you're not at your peak performance? Well, we're here today at Medical Aesthetics to help answer some questions on those symptoms. We are here to discuss the O and the P shot. Obviously, the O is the orgasm shot, and the P shot is the shot for men. And here in Medical Aesthetics, they do a procedure that helps with that. So come on in and let's learn more about it. Hi there, and welcome back to A New Way to Age. Today's our last episode of this mini-series, so I hope you all enjoy it. We are actually in Medical Aesthetics of New England shooting today, and our guests of this segment are George and Jasmine. Jasmine is actually the practice manager here at Medical Aesthetics. We're going to talk a little bit about bioidentical hormones because they both have done those, and we're also going to be talking about the procedure is called the O and the P shot. So welcome, both of you.
Thank you.
Thank you, Terry. Thank you so much for doing this.
You're welcome.
Thank you for including us. You know, the funny part is we talked to quite a few patients, and no one really, even though they're happy, wanted to come forward.
Sure.
So we decided, George and I, we are big advocates, and we'll come and talk a little bit about it. You want to start, or do you want me to start?
You go ahead. You're doing a fine job.
So let me say, so you both were on bioidentical hormones.
Yes.
Yes.
But you also had other symptoms that were not going to be able to be fixed with just doing the hormones.
Correct.
So you both learned about the O and the P shot.
Right.
The O shot obviously for women, the P shot for men. And what were your symptoms that you knew were going to be taken care of by this procedure?
Well, let me back up a little bit, if you don't mind.
No, sure.
You know, I went through menopause at a very early age, and kind of really made my life miserable. And when we started the bioidentical hormones here, it really changed my entire life, between, you know, the energy level, your brain functions, your libido, everything. But the interesting part is I had a disease which is called lichen sclerosis, and I wasn't actually aware of it until later on when we went for the actual training for the O shot and the P shot. And what it actually is you have a lot of dryness in the vagina, and you have a lot of itchiness. So most of the times I felt like a ball player, I mean, totally all the time. Like,
Right.
It was driving me crazy. And when we actually went down for training, we went down to Florida, being trained by Dr. Roy. Dr. Walter was, being trained as a practitioner, and I had the marketing portion. And of course, George and I, we were both guinea pigs. And that's at that point, Dr. Roy asked me, did you know you have lichen sclerosis? And I was like, no, what is that? So all the symptoms she was explaining to me, everything, I was like, oh my God, that's why the hormones totally haven't helped me out with that.
Okay, yeah.
So she did tell me that the O shot will do wonders, and it does. It's unbelievable. So even if you didn't have that, I know it helps a lot with the urinary incontinence, even with the libido. It's just that little extra, even if you didn't have that issue. So for me, I just would never stop it.
Okay.
And I'm sure George will talk about his portion, where since we were guinea pigs and, we were kind of, models in front of all the doctors in the room, to me, I didn't care,
Right.
I just needed like something to chill me out because I was so scared of that injection.
Sure.
And it didn't feel anything. I
Really?
mean, nothing. It was just nothing. Nothing happened. But George, I'll tell you, it was a different story. He felt like he was in a porn movie or something.
Jeez.
Yes, it did.
Right. Well, you're on
But I'm sure
display
he'll
at
tell
a,
you
at a big
all about it.
An
conference.
underpaid porn star.
Oh boy. Oh gosh.
Well,
Well, it was intimidating because you were at a conference in
Right,
front of
right.
all those people,
Correct.
and you're the model. So, understandably,
Correct.
both of you are going to need something to help you get through that.
well, it was not the actual procedure that I felt intimidated.
Yeah.
It's what followed, which I'm going to describe in a minute.
Okay.
Okay, but let me go back a little
Sure.
bit in history
Yeah.
regarding the hormones. About 6.5 years ago, I was diagnosed of cancer, lung cancer. So I went through surgery and I went through treatments, chemotherapy, and so forth. As a result of it, I was pushed towards an experimental medication.
Okay.
And that really amplified the issues with me. Issues meaning it affected my nervous system, it affected my skin. I was breaking out like crazy. I couldn't sleep. I have tremendous side effects.
Okay.
So following that, I went into hormones. And the hormones were able to eliminate a lot of those symptoms, anxiety and so forth. But also in the process of getting the different treatments, the post-cancer treatment, I developed diabetes.
Oh boy.
And diabetes affects a lot the libido and the sexual drive. So originally my sexual drive was up here,
Sure, yeah.
and then it started falling and falling and falling. Thank God never reached zero, but it was still low. It was not to my liking.
Right.
And that's why I was introduced to the P-shot.
Okay.
So they asked me to be an experimental guinea pig.
Right.
And I did. It was a very quick procedure, painless. I did not feel a thing, really. Dr. Walter did an excellent job with the needle. But with fairness, they put a lot of numb
Right.
cream on
Right,
that.
yeah.
So you don't feel anything, absolutely nothing. And it was embarrassing when somebody is doing voodoo on your personal things,
Sure.
you know.
Yes.
But the most embarrassing thing that I found, it was the public exhibit of giving a pump, and you have to pump yourself.
Pump yourself up.
Know the expression, and you have to pump you up. Well,
Yes. Right.
so they gave me this pump, and they asked me to do it in front of all these doctors.
Oh no.
So that was the embarrassing moment.
Sure,
Okay.
sure,
The
yeah.
reason they do that is because when they put the PRP in there, it has to quickly spread out, and they use this pump to bring that fluid all through around.
I see.
And that's the reason.
Okay.
But that was my only embarrassing moment. I didn't mind having 12 women watching, but
Well, you were a trooper. You really were.
so. But knock on wood, since then things went back
Okay.
to almost original level. I cannot say 100%.
Sure.
But almost to about 90% level of what I used to be. And I love it.
Great.
I love it. I enjoy life very much now.
Okay. Good.
So-
Good. Now, do you have to go through the procedure again, or is it one time?
It
or?
is
Yeah.
some people. I guess they go a couple of years. For us, it's been for me. You actually haven't. You have
I
not
have-
needed it.
yeah.
For me, it's been like 8 months and then a year. So
Okay.
yeah.
All right. So when did you both have this?
We
done?
had it done about a year and a half ago.
A year
It will
and a
be
half
2
ago,
years in
yeah.
August.
Okay.
And it still holds for me.
It's done.
Yeah.
Okay.
It still holds for me. The other thing I want to add to that, not to be ignored, that it's not just a P-shot done that way. Also, they use the same solution to inject different joints if you have pains. And my knee, I had a incredible pain due to injuries. And they put a P-shot, so to speak, right on my knee.
Here.
And then, yeah, PRP shot. Now they're making jokes about it. You can imagine,
Right,
like my knee is kind of stiff. No, it's not stiff anymore. But actually, I have not had pain since then.
Oh wow.
Knock on wood, yeah.
It went away like you wouldn't believe, and it started acting within hours
Really?
when they
You
did
felt
the
it that
shot.
quickly?
Yeah, it was very quick. And I was informed that that's a common practice with athletes.
Okay.
They have sports injuries. They give the PRP shots, and that gets them back again. So it's not just the sexual aspect of it.
Sure.
All right.
Sure. Yeah.
I don't want people to think that's all.
No, I'm glad
right?
that you pointed
Okay.
that out because that's important for people to know. Yeah. So Jasmine, like you said, it worked for you. What about your lichen sclerosis?
Unbelievable. So right now, I know Dr. Reynolds has been doing some more research with regards to having this treatment being permanent. So as of right now, I've needed like a couple of shots, not just a one time.
Okay.
So hopefully in the future, but I don't mind it. It's not painful. It has great results. So
Wonderful.
Yeah.
Great.
Yeah.
Well, I'm so happy for you both that this all worked out, and thank you for talking about it. It is kind of an intimate subject for people. Talking about their private parts, it's kind of embarrassing.
we don't mind sharing it as long as we can help
Right,
everybody
right.
else
Well,
out there.
It's
Well,
important for people to
Yeah.
know that there is something that they can do about it and make themselves feel so much better. And
Absolutely.
it's good to hear real people having it done,
Yeah.
not just seeing a video or something like
Right,
that
right.
about it. So
Yeah.
it's wonderful to have a real person perspective.
Yeah.
So thank you.
Some people, when we talk to different people about it, one concern they have is how painful it is,
Yes.
the pain involved. And when they describe to you the procedure, it's scary, but it's nothing
It's
like
nothing.
that.
Right.
Okay?
Yeah.
So
Right.
don't confuse the description of the act, of what's happening, versus the action itself.
Right.
There's no,
right. Well,
no problem.
that's big coming from a man because we know how sensitive that area
Oh, yeah.
is, and for you to say that it really didn't hurt, wasn't painful, is a good testimony to it, for sure.
One thing I would like to add, though, for anyone who is not on the hormones, I'm not so sure how it would work out for them, if
Okay.
it would really work as good as, if you were on the hormones.
Right.
Because to me, and what I have seen so far, and having gone through the training, is it's kind of a very nice addition to make it just a better life.
Enhancing the
Exactly,
hormones. Yeah.
Exactly.
Yeah.
One thing before we close I would like to show is my favorite paragraph by Suzanne Summers, which is the truth about menopause, right?
Yes, right. Would you like me to read it?
Please.
Okay. So it says, suddenly the 7 dwarfs of menopause arrived at my door without warning. Itchy, bitchy, sweaty, sleepy, bloated, forgetful, and all dried up. One by one, they crept into my own private cottage in the woods and started to take over my life.
Isn't that the
That
truth?
is funny. That is a riot. I think we can all relate to that.
I do too, although I don't have menopause.
No.
So I claim.
Yeah, andropause.
Yeah, there we go. There we go.
Yes.
Okay. Well, thank you again
Thank
so
you very
much. You guys are
much.
wonderful
Thank
to have
you.
on this show.
Thank you.
Thanks
Pleasure.
again.
Hi there. Welcome back to the second half of the episode of the hormones, bioidentical hormones, and the O and the P shot. So right now we're sitting with Dr. Walter. I'm going to be asking him a couple questions about the difference between the hormones and the O and the P shot.
Okay.
So what is the difference?
So we've talked before in this program about the bioidentical hormones, and the bioidentical hormones have a lot of benefits that incorporate over your whole body. There's obviously libido, but sleep, energy levels. The O and the P shot are really more concentrated specifically for women. The O shot is an orgasmic shot, and for men it's the P shot is a penis shot. So that's really more directed towards if there's issues locally, like not being able to achieve orgasm, if there's pain, that kind of thing.
Okay. And we heard in the first segment that both Jasmine and George went through the procedures. They said it's absolutely painless. Is that what you've been experiencing with the people that you've worked with?
Yeah, I think people, once they get the idea of what the procedure is we're basically taking your own platelet-rich plasma and putting it back into you, and then that unfortunately involves needles. But people, it's a sensitive area, so their presumption is that it's really a painful procedure. But what we do is we have a medical grade topical numbing product that we put on, and that makes it virtually painless. Sometimes it can be maybe a little mosquito bite, but most people feel nothing. That's for both men and for women, because of the numbing that we do beforehand.
Okay, great. George mentioned that he had to use an implement after. Is that ongoing, or is it just for a certain amount of time that they use that?
So the implements we provide are really for exercising the area. So initially we suggest that the men and the women use it fairly frequently, and we give all the instructions for this for about a month or so, and afterwards just 3 times a week. Just like if you go into the gym, you're kind of maintaining. That helps, just makes the PRP procedure a better procedure, the O shot and the P shot.
Okay. Is everyone a candidate for the O and the P shot, or are there certain specific people that are better suited for the process?
I'm not aware of anybody who's not. I mean, you can't be allergic to your own blood products. I had just read recently that there's been any side effects ever on an FDA-approved product to make the PRP, to manufacture the PRP internally here, and we do have one of those, as well as, I mean, theoretically, I guess it could be an infection, but we've never had one like that.
So for lay people, what does PRP stand for?
So PRP is platelet-rich plasma, and platelet-rich plasma, the analogy I use is, I'm just going to put this down here for a second, is if I cut myself here in my hand and do nothing to it, the blood is going to flow for a few minutes and it slowly slows down and then it stops and then it forms a scab, and then after the scab falls off there's like a pink scar and eventually the scar kind of fades away. And what causes all that healing to happen are platelets. Platelets are floating all around your bloodstream, and if there's an injury, the platelets go to that area, they help form the clot, and they help get the healing process going. And what platelets have is they have growth factors inside, and the growth factors draw in your own stem cells to that area and promote the healing with the nerves and the collagen, the blood vessels, the skin. Platelets are really what gets that all started. We have an FDA-approved method of concentrating the platelets because there's really sort of a sweet spot. You can't have it too little or it doesn't do any good. You can't have it too much because then the inhibitory factors sort of take over. So what we do is we draw your blood. There's a two-step process that spins it down, makes the platelets very, very concentrated. Pardon me, and we take a little bit of the plasma that's also spun out and dilute it so we have the adequate amount that we would insert either in a male or female. And they're basically about the same because it's put in several different areas.
Okay, so I'm going to just ask a question about the O shot.
Mm-hmm.
When women come in, what are the symptoms that they would like relieved by the O shot, and what exactly will it help?
Yeah, so usually it's a lot of women come in for decreased sensation. We have a big hormone program here, as we've talked about in the other segments of the show, so they have issues with libido, with vaginal dryness, with pain with intercourse. And there's also something called lichen sclerosis, which is really painful and can be very itchy. And it happens particularly for women after menopause, and it's where the skin gets really thin. Nobody really knows why it happens, but we've had some very good success with that, with injecting PRP, doing the O shot, but injecting it specifically that area, and it can make the lichen sclerosis almost disappear. The standard treatment for that's usually using steroid creams, and that can actually sometimes even thin the skin if you're using that too much. So it's really a nice benefit for that. The other thing the O shot is really, really good for is in stress incontinence. So sometimes after women have babies, you know, they cough and all of a sudden they leak a little bit of urine. And where we do the O shot, it's put right into that same area and builds up the collagen, and builds up some of the tissue in the area, and has a very high success rate, over 90% in getting
great.
having that resolved.
Right. Oh, that's great. Now, what about men for the P shot?
So the P shot, it's usually difficulty with erections, not having erections last very long or hard enough. And again, it's kind of rejuvenating the penis with doing the injections in that area. And again, I just want to reiterate that it's just not a painful procedure because of the numbing stuff that we use ahead of time, even though it is a sensitive area. The interesting thing with this is people can have intercourse that same day. There's no restriction of having to wait a week or two.
Oh, wow. Wow. Now, the P shot, I think you mentioned earlier to me Peyronie's. Does it help with that as well?
Yeah, Peyronie's is a painful, unnatural curvature to the penis, and that happens sometimes as men get older, and it's sort of internal scarring. There's plaque there, and the penis has a really strange curvature. So with intercourse, sometimes it doesn't hurt, and then nothing necessarily needs to be done other than for if the man doesn't like the shape of it. But sometimes with getting erections, it can be extremely painful, and the P shot really can make a big difference there. So it really can be very successful in helping to straighten out the effect of the penis.
How long has the O and P shots been on the market, per se?
PRP's been around itself for over 20 years. It really started first in the orthopedic field. They would inject into joints and would really to help with kind of rejuvenating joints. And the O shot and the P shot are trademarked, and I think they've been probably around for 5 or 6 years. And Kim Kardashian was the one who she promoted the vampire lift, and that's where this kind of took off. Just want to reiterate, the O shot and P shot, there's a very specific way of doing them, and all of us who do that, and there's not that many people around the area, but have had very specific training in how to do that, so we can kind of get the optimal effect.
Okay, and there's not many doctors in the New England area that do this?
There's not many people in the world that do that.
In the world, okay. All right, great.
Have had specific training to do that, yeah.
Okay, very good. So, Dr. Walter, getting back to the P shot, so if men have issues, so they sometimes take Viagra and Cialis.
Sure.
So do you take it in conjunction? Is this better, more effective than Viagra and Cialis?
It really just sort of treats different things, so there's no reason if a man gets better effects with the PRP and the combination of the other medicines, then they can take that, but some men are able to actually stop it because they just get enough benefit with the sensation, the erections, and the better orgasms with just the P shot, and then they don't have to take those medications.
Okay. And so how long, is this like a permanent treatment for everything, or how long does it last?
It is not. Usually the sort of the regeneration lasts typically for a year. Sometimes men get 2 years out of it, women too. So it's something, if you have good success initially, then you usually do about once a year.
Okay.
To kind of maintain it.
Okay. So Dr. Walter, so why were the O&P shots invented?
I think there's a big need for it because a lot of men and women, especially as they get older, they have issues with sexual problems, and a lot of times if they go to the regular doctor, either the doctor doesn't know how to take care of it, or there's sort of one or two solutions. Like sometimes women will be told to get started on steroid creams, and it just isn't very effective. So this it was developed to help with sexual issues that men and women have. The bioidentical hormones have been around for a lot longer, and the combination really seems to have an additive effect to it.
Okay, but you don't necessarily have to be on both.
No, you don't.
No.
Nope. In fact,
Okay.
if you come in for one thing and that's what you want, we'll we can talk about and answer whatever questions you might have and see if the combination's better or if just one or the other might be better for you.
Okay, so I'm sure everybody's going to have a lot of questions on this, so I would say that they should probably call Medical Aesthetics and set up a consultation with you just to go over everything that we just discussed.
Sure. That's how most people find out about us. They find out the details. They come in with questions and I try to answer the questions, or one of the staff will do that too.
Well, great. Perfect. Thank you so much for
Thank you very
today's
much for the time.
segment.
Thank you.
And I want to say a great thank you, firstly, to ActonTV for helping us through this whole mini-series that we've been doing, as well as hosting us here at Medical Aesthetics. Thank you to George and Jasmine for being on today's show and speaking so openly about the O and the P shot. Until next time.